welcome. It's 12 o'clock, and at least here in Sweden, and I thought we'd get started with this webinar today. So, hello everyone. Thank you for joining this webinar. I'm so excited to be here with you. It's been summer and haven't done a webinar in a while. So I'm here in Malmö, Sweden, where the TePe headquarters is, and you guys, you're all over the world. So, and a little bit of information here. If you have questions or comments, please post them in the chat box. It's really nice with some interaction during the webinar for me. Also, in the end, there will be a survey, which I hope you will fill out. I had this webinar yesterday as well, and I already looked at that survey, and we always do, and that's the only way for us to improve ourselves. So very nice if you would fill that out. Thank you. So I'm Lena. I'm a dental hygienist. I've been working at TePe Oral Hygiene Products for about 7 years as an educator. And before that, I worked at the university in Malmö, and I worked clinically in Malmö and in Vienna in Austria. And I'm pretty involved in the dental hygiene scene. I write some articles for the magazine here for the association, and I'm also the chairperson for the local branch of the association. So it's dental hygiene around the clock almost for me, I would say. So an overview of manual toothbrushing. So as you can see in the picture, we have a lot of nice toothbrushes, but I think we're most famous for our interdental brushes actually. But like you can see, we have a very nice range of toothbrushes and also special brushes, specialty brushes and accessories. So why am I not speaking about electric toothbrushes today? Well, as I will show in the next slide, the market for manual toothbrushes is still very, very big. Manual toothbrushing should continue to play a large role in patient oral hygiene education. And talking about pros, just think about the crazy prices on electricity right now, where taking a shower costs $2.50. A manual toothbrush does not require any electricity, doesn't have to be charged. So also from another sustainability aspect, we produce as sustainable products as we possibly can. We produce them with solar energy or other renewable energy resources. We only produce products from plant-based material, and we have packages that can be recycled. So there is a lot of focus on electric toothbrushes, but not so much talk about their impact on the environment. So anyhow, we might do another webinar on manual and electric toothbrushes, but today it's all about using your own muscle power. So like I said, it's a big market. If you look in Australia, for example, they sell 35 million manual toothbrushes every year, which is 80% of the toothbrush market. And then worldwide, annually, there's 3.5 billion manual toothbrushes being sold. And then here for us, we can say that the toothbrush Select in that picture, that's still our #1 toothbrush after many, many years on the market. And we sell about 17 million toothbrushes per year, and at least 3 million of them were produced with our very own solar energy last year. And this year, it'll be even more. So you can really make a difference by recommending a toothbrush from us. Because if you recommend toothbrushes made from bio-based plastic produced from renewable solar energy, that's at least one step in the right direction. So what about toothbrushing then? Why do we need to brush our teeth? Well, because it, of course, removes that harmful oral biofilm that we don't want to be sitting on our teeth. It's also a mean of delivering fluoride to our oral environment to help resist demineralization following sugar consumption. Relatively simple, it says, Yes, well, we can discuss that, but also a low-cost behavior. So that's another pro, I would say. If you look here in Sweden, a 6-pack of the Select brush is very, very cheap. So I did a little bit of counting. If you your whole life use a Select, then you buy a 6-pack and you live to be about 80 years old, you will spend about $230 US, it's about the same in euros, on toothbrushes. And that's what one electric toothbrush costs. So for many people in the world, an electric toothbrush is just not an option. And we have to think about that when we recommend toothbrushes to our patients. So these numbers, they make it pretty clear that we need to improve people's knowledge on toothbrushing and also their technique, of course. Very high numbers here on gingivitis, maybe an average across the globe, about 80% or something. So toothbrushing is a health behavior performed by a majority of people at a regular basis. It's an automated behavior or habit for many people. Still, oral disease, like we saw gingivitis, for example, is very, very common. But let's look a little bit into this automated behavior, because I've had this slide for a while, and then I felt I really wanted to go into, is it really an automated behavior? And then there's this study, Oral Hygiene Behavior Automaticity, with 150 participants with a questionnaire. And they state here that this study provides clear evidence for the first time that toothbrushing is performed habitually. They also said that the scores for morning toothbrushing, they were higher than evening toothbrushing, meaning that people more often stick to their morning habit of brushing their teeth. But then what is really a habit? Well, habits are defined as automatic behavioral responses initiated by individual salient cues or stimuli. Cues can be time, for example, that you do your behavior at a certain time of day. It can be activity, that you do a behavior at the end of a predetermined activity, like brushing your teeth after you take a shower. Or event-based, initiating behavior by something in the environment. So these habits are established by the constant repetition of behavior following encounter of a cue in a stable context. And here's another statement. This is another article, but it's the same author. So they say that the distinction between morning and evening toothbrushing behavior was evident. And here they interviewed 29 people, so it was semi-structured interviews. And morning brushing was consistently described by participants as being strongly integrated into their well-established daily cleansing routines, such as showering or face washing. Then we can read in the book, Clinical Practice of the Dental Hygienist, that a clean mouth before going to sleep should be encouraged, because bacteria thrive in the dark, warm, moist climate of the oral environment. So this variance in the evening routines that may result in missed opportunities to brush your teeth. You know, in the morning, maybe we do have better habits or a better routine, and then the evening is, maybe a little bit so-so on our routines. And from previous research, you can find out that it doesn't matter if you miss a day or two, but if you miss a lot of days, then it's really affecting that habit formation in a negative way. So how can we help our patients? Well, to find that cue, maybe you don't have to wait and brush until you go to bed. Maybe you can actually brush after dinner. So that putting that cue after dinner, I brush my teeth. It's about helping our patients to find their own cues, of course. So studies show that patients have a lack of knowledge when it comes to disease etiology and prevention and how to perform oral hygiene. And for some, that can be in combination with a lack of habit. But I thought we would talk a little bit about knowledge now. So this is a study by Renate Deinsel. We'll talk about her a little bit more in a while. They had two groups of young adults where they compared the group do your best. They were told to do their best in front of a camera, clean their teeth. And then we had another group called do as you usually do. So they were told just brush and clean your teeth the way you always do, and we'll just film you. And then let's look at the two groups. So actually there was no difference between how they were brushing. Most of them were just scrubbing their teeth. They were also not aware of brushing systematics. Both of them neglected the inner surfaces. In the do your best group, only 15 out of 98 cleaned between their teeth, and they didn't clean all gaps. Also, they brushed the occlusal surfaces 3 times longer than the palatal surfaces. The do your best group, they brushed for 3 minutes and 20 seconds, so that's quite long. The other group brushed for 2 minutes. But the time that the do your best group spent on the inner surfaces was the same as the other group. So they pretty much did what in literature is known as the cosmetic brushing. They focused on the buccal surfaces. And as always, we have to ask ourselves, what can we learn from this? Well, if we want to know about our patients' oral hygiene behavior, we have to kindly ask them to show us, because otherwise we'll never know. Also, to ask someone to brush better, well, that's pretty useless because they will only brush longer. So we need to correct and show proper methods because just giving advice doesn't work. Yeah, so this is a picture of Renate Deinzer. She's a psychologist who specializes in medical psychology and has written a lot of interesting articles. So I really think you should go into PubMed and look at them. She works at a university in Gießen, Germany, and I had the pleasure of listening to her and talk to her at the Europerio in Copenhagen in June this year. So she presented this, why daily toothbrushing fails to keep gums healthy. So we have a high prevalence of oral disease, but we also have oral health education, which is an important treatment strategy, and we do it a lot. So anyhow, Renate thinks that people still, in the Western world should know a lot about periodontitis and its prevention. But the question is, do they really? Good question. They did this by telephone interviews, and they had open-ended questions, and they were partly followed by single or multiple choice queries. Also, I'd like to add that this is unpublished data used with the consent from Renate. So what they did was divide what people should know and understand into this 6 groups. So definition of periodontitis, that you knew that it was an inflammation that also affected the alveolar bone, for example. Important risk factors, potential consequences, preventive measures, important sites for you in your mouth, and then methods of toothbrushing. They asked some questions like, what's periodontitis? Do you know the consequences of it? Do you know the risk factors? What should you look out for if you want to clean your mouth really good? And in which areas is it particularly important to clean and remove plaque? And more questions, of course. So here are some statements that a lot of them, so like you see, 63% of seniors, and so on, agree with the statement that to avoid periodontitis, it is particularly important to brush the chewing surfaces. Then we have quite a lot of people that doesn't agree with the statement that periodontal disease is caused by plaque. And yet even more people does not agree with the statement that good oral hygiene prevents periodontitis. So when they looked at the results, it was pretty depressing. And only for potential consequences, people knew a little bit. So at least that's good. Maybe we have come across with the message about the connection between periodontal disease and CVD and diabetes. But for the other groups here, you can see the result was very disappointing. So the answer to the question, do people really know a lot about periodontitis, is thus no, at least not yet. So her advice, Renate's advice for how we move forward, is to have a greater focus on periodontal disease from young age to old age. She believes that there's so much focus on caries at the beginning of life that it then becomes difficult to broaden the focus and think about that there's actually another equally important oral disease. She also says that the majority of 12-year-olds in Germany have gingivitis and that they simply brush too poorly, especially along the gingival margin. Donata's other advice is that the dental care team should not overestimate the patient's oral health literacy, that is their knowledge about oral health, and that we should remember that patients are used to thinking about caries, but not so much about periodontitis. And just to follow up on that is that you saw that the statement that they thought you should brush the chewing surfaces, and that kind of reflects what she says, that people are very focused on caries. So when you talk toothbrushing to your patients, maybe you're talking about the brushing technique, the design of the toothbrush, and the duration and frequency. So let's go through some techniques here. Well, we have the charters. That was the earliest published toothbrush technique, described in 1928 for patients with orthodontic-itis. The brush is positioned opposite to bass, pretty much, with the filaments directed towards the occlusal plane. Then we have Stillman, developed by Paul R. Stillman in 1932, involves the placement of the toothbrush bristles partly on the cervical portion of the tooth and partly on the adjacent gingiva at a 45-degree angle. It's designed for massaging and stimulating the gum and cleaning cervical areas. The modified Stillman then involves the roll by brushing the final strokes towards the occlusal surface. And then we have Alfred Phones, and he was the founder of the first course for dental hygienists in the US. He proposed a new eponymous brushing technique where the toothbrush was placed on a set of teeth and the bristles used by slightly pressing them onto the interface between the tooth and the gingival margin. So then the toothbrush head is moved circularly 4 to 5 times and moved to the next set of teeth. And this could be used as an easy to learn method for children maybe, but looking at what Deinzer says, I think maybe it's better to learn a good technique from the beginning. Then we have Mr. Charles Bass recommended to pushing the bristles into the gingival crevices and sulcus between the teeth at a 45-degree angle to the long axis of the tooth with a short back and forth movement. And then we have the modified Bass that, just like the modified Stillman, involves that rolling action. And Bass, as you know, is widely used. And I did a poll on this actually, and we had 93% that said that they recommend Bass. So yeah, very widely used. And then we have the scrub, which is like the very not technique sensitive. It's the, you know, circular, horizontal, vertical strokes. I normally say that this is what they use in movies, where you see they're brushing very intensely in the bathroom. There's a lot of foam in the mouth, and they're always talking at the same time and scrubbing very intensely with a 90-degree angle towards the long axis of the tooth. And then we have the roll, which we already talked about a little bit, where you just place the bristles parallel to the gingiva, and then you do strokes towards the occlusal surface. And then you have the toothpick method, which was a little bit new to me, but I don't think maybe I would recommend it. But you can look on YouTube. There's some movies presenting this technique. It feels a bit strange because you can't really get the toothbrush between the teeth. If you have very tight spaces and you're supposed to kind of push it between your teeth and then thrust it 8 to 9 times between your teeth. So look for that on YouTube, the toothpick technique. So then, of course, you wonder, yeah, but which technique or method is the best one? Well, if you want to find out what's the best one, you have to go to a systematic review. This one is from 2020, and they wanted to identify and assess the quality of evidence of manual toothbrushing techniques, and they included 13 studies. So studies indicating statistically significant superior plaque removal for a given technique were all different. So you can see one for baths, one for modified baths, 2 for charters, 2 for phones, and so on. So insufficient evidence for suggesting one toothbrushing method is more effective than another in plaque removal and reduction of gingivitis. Also, adding to what they say here is that they had 10 different plaque index systems. 7 studies provided no information on the percentage of bacterial plaque reduction. 1 study was in vitro. The number of individuals were okay. Most studies used 50 to 100 people, but there were young individuals. And only 1 study included previous periodontal patients that were 20 to 49 years of age. Instructions were different in all studies. 2 studies reported gingival index, the others not, and they used 23 different brands of toothbrushes. So pretty much we can't say anything out of this one. Sadly. So toothbrushes, again from the book Clinical Practice of the Dental Hygienist, here's a statement that dental professionals must maintain a high level of knowledge on these products to advise patients appropriately. So then a short history of toothbrushes, that from the very, very beginning, they were chew sticks. And of course, they're still chew sticks in some countries. But the earliest record of these chew sticks dates back to the Chinese literature about 1600 BC. Then they used hog bristles and horse's hair. And in 1728, Pierre Fauchard condemned the toothbrush made from horse's hair because it was rough and destructive to teeth. So that's something I don't recommend then, the horse's hair. In the early 19th century, people had exclusive handles with replaceable heads, so very sustainable already then. And these exclusive handles were made from gold or ivory or ebony. Middle 19th century, the first patent for a toothbrush in the US. And then celluloid came, which brought out a lot of new varieties. And then in 1919, the American Association of Periodontology provided specifications for toothbrush design and brushing methods. And in 1938, actually the same year that the Swedish Public Dental Health was founded, nylon came, which of course changed a lot of things. So how do we choose our toothbrush? This is a picture from a pharmacy here in Malmö. Well, cost might be a factor, of course. Availability, is it around the corner or do we have to, go get it at a special store? Advertising claims, family tradition, habit. That's from a book. And then I've added sustainability aspects that I really hope that people are thinking about these days. And then also recommendation from your dental professional, which I also hope that people are thinking about, of course. So maybe you didn't know this, but there's no standard for bristle firmness. So a TePe Soft is not the same as another brand's soft toothbrush. So that's why that sentence is there, but you really have to know a lot about toothbrushes. So it doesn't, if your patient says, well, I'm using a soft toothbrush, it doesn't really tell you anything because then you don't know the brand or anything. So it's really good to always tell them to bring their oral hygiene products to the clinic so that you can actually see what they're using and how worn it is, maybe even. But anyhow, the things that determine the bristle firmness or the filaments firmness, that's the diameter. So a smaller diameter, of course, is softer brush, the length of the bristle, what the material you use. So we talked about nylon, but there's also PBT, and we use castor oil for some of our filaments. So there are different materials. Then the numbers of filaments in a tuft. You put a number of filaments together into a tuft, and then that tuft is placed into the toothbrush head. So of course, it differs how many filaments are in that tuft. Then we have the angle of filaments as well. So is one toothbrush better than the other then? Well, according to Dagmar Slott's study here, there's insufficient evidence that one type is better than the other. But then they compare the flat trim that you see in the picture here and a multi-level toothbrush, such as our TePe Supreme. And they say that a multi-level toothbrush can be a little bit more efficient than this flat trim toothbrush. But like you can see here, it's about 7 to 9%. So what do we look for when we make our toothbrushes? Well, we want to have a small tapered head, and we want it tapered to ease access in the posterior region. Then quality material, of course. We do a lot of tests on our toothbrushes. And rounded bristles, please always look for that when you are looking at toothbrushes or recommending them. It's very important. A good grip. So we have toothbrushes with different grips, so you can choose your own grip. And then a hygienic design so that you can rinse it off easily and also rinse the bristles from food debris and whatever is left there after toothbrushing. So that's also important. So we really try to produce good toothbrushes, but we also have to bear in mind that maybe the best toothbrush is the one that is actually properly used. And also remember that there are no studies that says that more bristles are better. There are some claims that it's better if you have more filaments in a toothbrush, but there is no scientific evidence to support that. There's actually one article only that compares toothbrushes with 5,000 and 2,000 bristles, and it was not in favor of the toothbrush with 5,000 bristles. So some claims, they're just marketing claims. Yes, I will now show you a movie. Yes, and hopefully we're back to the screen. So as you saw there in the movie, we started on the inside. And if you ask people where they normally start brushing their teeth, they will say the buccal surfaces. Of course, there are always some that start on the inside or the chewing surfaces, but most people do start on the buccal surfaces. So why do we say start on the inside? Well, because normally there is a lot of plaque on the inside, and toothpaste is of course abrasive, and we know people focus on the buccal surfaces, and that's where we see all of that recession. So recommending starting on the inside is a pretty good tip. And also to have some systematics when you brush, to then brush the whole inside and then maybe the chewing surface and then the outside, or if you prefer inside, outside chewing surface. Also depends, of course, if you have children, then a lot of people recommend to start brushing on the chewing surfaces actually. When we're brushing further back, you have to close the mouth a little bit. That's also a tip that we can give. And everyone who's been brushing on children know that they need to close when we want to brush the upper buccal surfaces, for example. Then to change toothbrush when the bristles are splaying, normally after 3 to 4 months. If it happens before, then usually, of course, you're pushing too hard. And also to slow down. I don't think a lot of people have timed themselves really when they brush. But here are 2 studies that talk about that. So we have one that's pretty okay, and then the other one is from 1 to 2 minutes. So of course we know that 1 minute is a little bit too short. So most people in Sweden are aware of these sort of rules. It's easy to remember, 2, 2, 2, 2. And even though we know a lot of people may not be following them all the way, still it's good to bear in mind, and most people do bear it in mind. So we recommend to use 2 centimeters of fluoride toothpaste, brush twice a day, brush for 2 minutes, and don't eat or drink for 2 hours after brushing. And I know in some countries, like Finland, they recommend brushing before breakfast. So that can be individual, of course. So what about brushing twice a day? Do people do it? Well, I have some studies here about that. And the kind remember, of course, is to not ask your patients about how often they brush, but to ask them if they would like to tell you about their oral hygiene habits. Let's start in Serbia, where they looked at students, and almost all of them brushed every day, but only about half of them brushed twice a day. And then we have Finland, with a study saying that about 80% of women brushed twice a day, whereas only 54% of the men brushed twice a day or more. Here we have something from Eilish Duffy. She's an Irish dental hygienist who lectured for TePe at the ISDH now in Dublin, so we were so happy about that. And I borrowed her material here. This is also unpublished data, but she did an online survey, and from the people here, 47% said they brush more than once a day, 29% brush once a day, and 4% brush occasionally. And these numbers are very poor in this cohort, as all the participants had a known diagnosis of diabetes mellitus, and 63% of them had an HbA1c that was higher than 6.5%. And we all know that those people really need to brush good every day. Here we have from a different part of the world, Korea, where they have a different thinking maybe about toothbrushing. So this is from a national health survey where they have taken a lot of data. So there's quite a lot of studies from this survey. You can see 68,000 people, quite a lot. And despite that the government and also private organizations have been carrying out projects for oral disease prevention and early diagnosis, they still state that more than 85% of adults have gingivitis and periodontitis with poor oral health or accompanied by bad breath. And in this survey, you could report how often you brushed your teeth from 0 to 8 times. So you can see already there that it's quite a lot with 8 times. So they filled in like after waking up, and then before, after breakfast, before, after lunch, before, after dinner, and evening. So, and a lot of things, of course, affected how often you brushed, demographic factors, socioeconomic factors, so you can see gender, education level, income level, work type, and we know all of that affects. So when they compared for these 9 years, it did increase, and they said, but it was still 2.66 times per day, not exceeding an average of 3 times per day. And I go then, what? 2.66, that's really, really good. You should be happy about that, but they really want people to brush 3 times a day. That's their standard. They don't have the 2 like we do in Sweden. So looking at that, of course, they feel this is a bit disappointing. There are also some previous studies from Korea where you can see 62.5% brush twice a day and 52.5% brush 3 times or more. So to me, that's high, but for some other, it's low. Here we have another country, Mexico, and they looked at children here aged 6 to 12. So you can see that the prevalence of toothbrushing at least twice a day was just over 50%. So then again, that breaks your heart a little bit that it's that bad. Moving on to Australia, again, a national survey, children aged 5 to 14, a big cohort here of almost 25,000 questionnaires. And some background here is that in Australia, 1 in 4 children has untreated dental caries in their primary teeth, and also they recommend to start with fluoride at 18 months. So let's look at some results. The mean age of starting toothbrushing with fluoridated toothpaste was 24.1 months. So for me, being a Swede, where we love fluoride and recommend to start with fluoride toothpaste already when the first tooth breaks through, 2 years is very, very late. 68.5% of these children were found to be brushing twice or more a day. So of course, also that should be higher. We also have some factors affecting here. If you had public health welfare card belonging to single parent or guardian families, then you were less likely to brush twice or more per day. Also, if you didn't brush twice a day, you also started with fluoridated toothpaste later. And here we have some other factors like female children with university-educated parents, high family income, living in households with 2 children or more were more likely to brush twice or more a day than their comparative counterparts. And I guess that part with where you have 2 children is better than 1 child when it comes to toothbrushing. I guess maybe you learned from the first child and then you're applying that better on your second child, I would say. That's just a guess. Here we have another one from Australia. Again, this survey with parents. So the children here were a little bit younger, 2 to 8 years. Yeah, this is even less actually. 52.5% of the children brush their teeth twice or more a day. So definitely some work to do out there. Okay, so now to sila skum, or as we translated to, sift the foam. We also recommend here to not rinse after brushing. Just take a little sip of water, wash that mixture around in your mouth for 20 to 30 seconds, and then spit out, and don't rinse with water again. And this goes, of course, hand in hand with that the last 2, don't eat or drink for 2 hours after brushing to keep fluoride in your mouth as long as possible. So can we really say that? Well, yes, because here's a study about that, where they wanted to evaluate the effect of different toothbrushing routines and different kinds of toothpaste on the interproximal fluoride concentration. So they measured the fluoride concentration after brushing at different points. So they compared 1 or 2 centimeter toothpaste, 1 or 2 minutes of toothbrushing, and then afterwards rinsing with 10 or 20 milliliters of water after brushing. So they saw that the amount of toothpaste, how long you brush, and how much water you took afterwards, all of those had a significant effect on the interproximal fluoride concentration after brushing. And second bullet point here, you can see that an increase in fluoride concentration of 47% was observed when you used 2 centimeters of toothpaste instead of 1 centimeter, and increased 26.8% when you brushed 2 minutes instead of 1 minute, and also increased with 40%, a little bit more, when you reduce the water you rinse with from 20 milliliters to 10 milliliters. So hence the 2 minutes, 2 centimeters, 10 milliliters of water there. So these results, they confirm the importance of giving clear advice to patients regarding the toothbrush. So toothbrushes, we have a couple of different ones, so I'd like you to meet them. First up is TePe Select, which I said was the most sold toothbrush in Sweden. It's I think it's 25% of the market in Sweden actually. And it's our basic toothbrush with a flat trim. You can bend the neck if you want to, just hold it in warm water for 30 to 60 seconds, and then you bend it forward, backwards, whatever you like, what suits you and your patient, and then you can put it in cold water and it stays like that. But don't bend it back and forth, just do that once until you get the desired angle. So in the Select family, we have Mini, which you start with from the first tooth, and then you can use that about to 3, 4, 5 years of age. As you can see, it has some nice illustrations there, but of course it also comes without illustrations if that's something that you prefer. And the same goes for kids, with or without illustrations. So that's the next toothbrush size from, then from 4H or so. And that's actually the same size as the compact one. But this one then doesn't have any illustrations, but instead has colored filaments. I'm not going to say this is a kid's brush, because anyone adult preferring a smaller toothbrush, this is a great example of that you can use a smaller toothbrush. So that was the Select family. And then we have Novas, and as you can see, maybe there's a different grip on this one, with a better grip with the thumb, maybe. That's what you prefer. It's available in extra soft, soft, and medium, and it's the color of the tip that indicates the bristle firmness. Since it has that tip, it's really good for the inside. If you have a wisdom tooth that hasn't erupted fully, maybe, or if there's a lot of plaque in the posterior regions. And this we have in regular size. Then we have the TePe Supreme, which is also very, very popular, with the filaments in 2 levels. So first there's a lower one that's end rounded, and then there's a top one that's tapered bristles. Really getting into sulcus, you can feel that good when you brush. We have that in regular and also in compact, and it's really popular for ortho, and you can see those tapered filaments there going into sulcus in the clinical picture there. Then Good is actually just like Select, but it's just that it's the first product that we made that was sustainable, so that's why it's still called Good. But our regular Select is also made from bio-based material now, just not the same bio-based material. So this is Good. It's made from sugarcane. It has a little bit of a different feel and a different flexibility. The bristles are made from castor oil. Of course, getting also very, very popular, and reducing the carbon footprint a lot, of course, because that sugarcane absorbs a lot of CO2. Then I have to show you the extra grip, because I think it's such a great product that you can put on Good, Select, or any of our specialty brushes. So for any of those patients that have a problem with their dexterity, this is a great thing to recommend. And it looks like this when it's put on the toothbrush, and very easy to insert and remove. You just knock, so you don't need any muscle power. Yeah, just a great product that we sometimes miss to talk about. Then, of course, what's the toothbrushing instruction without plaque disclosing? Yeah, well, I love this product. You can see here that it's 2-tone, so you have red or maybe pinkish more for the new plaque, and blue for the old plaque that's more than 12 hours. It's a chewing tablet. It can be used at home, or you can use it at the dental office. It's also safe to use for children whenever they're old enough to rinse and spit out, which is maybe around 5 years old or so. And of course, they have to be supervised by an adult. But this is so good. You know, you show your patients the plaque, and I don't know, you can't do toothbrushing instructions without it, I would say. I know everyone uses it at university because we have to, because the teachers tell us to do it. And then when you get out and start working, I think a lot of people maybe miss this a little bit, because for different reasons, for time maybe, but I think it's great to use. So please try to use that if you can. But really, how efficient is toothbrushing? Well, again, from Dagmar Slot here, we have a review where they looked at different studies, how much plaque people removed when they brushed. So just take average Joe walking down the street, removing about 42% of plaque. They also did the same with electric, actually, finding out that they removed 46% of plaque. So there's a lot of people walking around with a lot of plaque, and let's not forget incidental cleaning, but that's a different webinar. So just a quick note on what you do when your toothbrush is worn out, which normally would be after 3 to 4 months. It's actually up to each and every one of us to find out how a toothbrush is recycled in our country or part of the world. So in Sweden, we put our toothbrushes in the residual waste bin, which is incinerated and then used to heat our buildings. In some countries, you can put the handle in the plastic waste, but remember to always cut the head off, because the head does contain a little bit of metal, which is used to attach the bristle tuft to the toothbrush head. And remember to never throw anything away in nature. and that also goes for wooden toothbrushes. And the same goes for wooden toothbrushes when it comes to the metal. It's also in the head. So what's my take-home message today? Well, don't rule out manual toothbrushes as a perfectly good alternative for your patients, especially not if you're concerned about sustainability. Don't overestimate people's oral health literacy and their knowledge about oral health. Brushing your teeth isn't just not something you know how to do. We have to be shown how to brush our teeth. And don't forget to use an agent to disclose plaque, and make sure to spend some time on helping your patients with their brushing technique or brushing systematics. Then we have a sneak peek for you. So just give me a second and I will start a movie. Now we should be back. So I'm not gonna say anything more about that right now, but I hope you think that's as exciting as I do. Then I really hope you join us for our November 9th clinical symposium called The Heart of the Matter. And remember, as always for our webinars, also for the clinical symposium, as long as you register, and if you happen to not being able to watch live, you will get a link with the recording afterwards. So you can watch this symposium on a Friday night with a cup of tea if you want to. But of course, we would love it if you would join us live. We're very excited about this. Like I said, it's November 9th at 7 p.m. Swedish time, CET. And we have here Søren Jepsen, a periodontist from Germany. We have Helen Minery, she's a dental hygienist from the UK. And we have Anna Norhammar, who is a cardiologist from Stockholm here in Sweden. So they will get together and talk about the connection about perio and cardiovascular disease. So they will explore that connection for about 2.5 hours. So very welcome to join that one. It's free, of course, and you sign up on our website. So go there to read some more about that. Then, of course, we have other webinars coming up. Next month, we have one on dental management of patients with eating disorders. And then in October, we have peri-implantitis management. And also very excited to, for the first time, present a bilingual webinar. So we will give it one time in Italian and one time in English. It's an Italian dental hygienist that's giving this webinar. So very excited about that too. Lots of things to be excited about this fall. And then just to remind you about that survey that I really hope you fill out. So thank you so much for watching. I will now look if we have any questions. Let me just pull that out. Or you can always write them now if you feel like that. Or you can always email us if you have comments or questions, of course. I'll try to drag this out a little bit. Thank you for that comment. It's a positive comment. Sometimes it's a little bit difficult here to see, but okay, someone said you couldn't see the video. Well, I hope that some of you saw the video. I don't know. There's always some technical issues with these webinars. But anyhow, thank you so much for joining. Is there a TePe ambassador scheme in the UK? I'm not sure exactly what you mean. We do have a sort of extended clinical team, but if You're welcome to email us at the webinar address. You know, you get a lot of emails here from the webinar, so you can just email there and I will pass it on to the UK office if it's something specific for the UK market, because I'm not exactly sure what you mean. Let me see if there was something else. Yeah, why 2 centimeters of toothpaste? Yeah, maybe I should be clear about that. 2 centimeters is from 6 years and up. And P size, we say from 2 to 6 years. And from 0 to 2, we say that you just put the smear layer on top of your toothbrush. So a little bit different here, of course, but 2 centimeters is from the research on that you saw before, that they have measured how much fluoride is left in the mouth after toothbrushing. And if you don't use enough toothpaste, of course, you're not going to have enough fluoride left in your mouth to be of any use. Yeah, thank you for that question. I think that should be it. But like I said, email us if you have more questions. So thank you so much. Enjoy the rest of the day if you have any left of it. And I really hope to see you here for another webinar soon. Bye-bye.